Good afternoon, everyone. We're going to now start this subcommittee of Health and Human Services. And today we have 3 readouts from respective agencies. And we'll start with the Department of Disabilities with Ms. Natalie Andrade.
Thank you, Mr. Chair. Good morning. I am Natalie Andrade, here with the Department of Legislative Services to present the fiscal 26 allowance for the Maryland Department of Disabilities. As you can see on page 1 of the analysis, you will see that the fiscal 26 budget increases by $4.1 million, or 32.6%, bringing the total to $16.5 million. This increase is primarily driven by an additional $1.6 million in special funds and $2.4 million in federal funds. The additional federal funds result from new grant awards, while the special funds reflect increased demand for telecommunications access Maryland programs. On page 3, Exhibit 1 provides a breakdown of the fiscal 26 allowance. Personal expenses account for 33% of the total budget, with the Office for Individuals with Disabilities receiving the largest share of personal funding at $2.6 million. Other significant portions of the budget include the TAM programs with 26% of the budget and the attendant care program with 8% of the budget. Turning to pages 4 and 5, Exhibit 2 outlines the key changes in the budget. The $4.1 million increase is largely driven by $2.2 million in federal funds supporting 2 new federal programs. The first one is the Development of Inclusive Futures and Improving Children's Assistance Program. Additionally, $1.2 million in special funds is allocated to meet growing demand for accessible telecommunications equipment for Maryland's deaf and deafblind communities. On page 7 in the personnel section, the fiscal 26 budget includes the conversion of 1 contractual position at the MDTAP program into a regular position and a net increase of 3.5 contractual full-time equivalent positions. These new positions will support disability employment initiatives, MDTAP operations, and administrative assistance for TAM. Additionally, the 24 JCR requested the agency to report on 2 vacant positions and recruitment efforts. The Maryland Department of Disabilities faced challenges filling the advanced accountant role due to market competition and is using a contractual hire while planning the 3rd recruitment. The Developmental Disabilities Council attempted recruitment but found not qualified candidates and is considering restructuring the positions. Both positions remain vacant as of December 31, 2024. Now jumping to the key observations section on page 8, there is a discussion of the Universal Services Trust Fund expenditures. And on page 10, Exhibit 3 provides an overview of the Universal Service Trust Fund expenditures, which increased from $2.7 million in fiscal 19 to $4.9 million in fiscal 24. This increase is primarily due to expanding Maryland Relate and Maryland Accessible Telecommunications Program, as well as introducing new initiatives like the Senior Call Check and Communication Facilitator programs. Maryland Relate expenditures alone rose from $1.4 million in fiscal 19 to $2.1 million in fiscal 24, reflecting both higher relay service demand and contractual cost increase. The MAT program's budget nearly doubled from $401,000 in fiscal 19 to $965,000 in fiscal 24, driven by increased adoption of telecommunications equipment among Maryland's disability community. On page 11, Exhibit 4 presents projections for the USTF balance, showing at the current surcharge rate of 5 cents per communication service bill, the fund will run a deficit beginning in fiscal 26 with a projected shortfall of $860,000 by the end of fiscal 27. If no adjustments are made, the fund's deficit will continue to grow, reaching $5 million by fiscal 29. A budget amendment submitted in December 24, which is not reflected in the fiscal 25 working appropriation, added $2.5 million in TAM program funding, increasing Maryland Relay's budget from $800,000 to $2.2 million, and MATS from $702,000 to $1.3 million. These adjustments were necessary due to higher than expected demand for accessible telecommunications equipment and slower than expected reductions in Maryland Relay traffic, particularly among older adults and rural residents. So the agency should comment on whether it anticipates revising the timing of its recommended surcharge increase to address the fund's earlier than expected depletion, and what alternative measures are being considered to stabilize the fund. On page 12, the key observation 2 presents a proposal to create a new Office of Disability Employment Advancement and Policy within the Maryland Department of Disabilities. As introduced in fiscal 25 session, this office will oversee the Maryland as a model employer initiative, which will focus on inclusive recruitment, training resources for state agencies, accessibility improvements, and workforce data collection. And the agency is expected to integrate these efforts within its existing structure and evaluate the initiative's impact. So the Maryland Department of Disabilities should clarify how it will align this new office with its current programs and whether additional resources will be needed for successful implementation. And to conclude, on page 14, the Department of Legislative Services recommends concurring with the governor's allowance. And with that, I conclude my presentation, and I'm happy to take any questions that you may have.
Thank you, Ms. Andrade. Seeing no questions, at this time, I'd like to bring up Madam Secretary.
Good morning, Chair McCray and members of the Health and Human Service Subcommittee. For the record, I'm Carol Beatty. I'm the Secretary of the Department of Disabilities. And thank you for this opportunity to appear before the committee today and as you review the proposed operating budget for the Maryland Department of Disabilities for fiscal year 26. We also want to thank our DLS analyst, Ms. Natalie Andrade, for her very thorough analysis. At the witness table with me today is our new Deputy Secretary, Ann Blackfield, and our Assistant Secretary, John Brennan, for operations. And in the audience, we also have Jade Gingrich, who is the Director of our Employment and Transition Policy team, and also Rachel London, who is the Director of the Developmental Disabilities Council. And you have our written testimony. So with your permission, Mr. Chair, I will discuss the issues raised by the analyst. And we've been asked to comment on whether MDOD anticipates revising the timeline for on the recommended surcharge increase for the Universal Services Trust Fund due to earlier than predicted fund depletion. And we thank you for the opportunity to address the timing of the surcharge increase to stabilize this fund. In an effort to stabilize the fund, we requested and received a surcharge increase to 9 cents from 5 cents beginning fiscal year 26 from the Public Service Commission. This surcharge adjustment will address the fund's earlier than expected depletion and bring us back to the recommended fund balance of 1 year of operating costs. And in addition, I just wanted to make sure that you also know that in addition to the surcharge increase, we are implementing cost-saving measures to further stabilize the fund. which we have outlined in our written testimony. And we've also been asked to comment on Senate Bill 433, House Bill 502, which is legislation that was requested by the governor this year to establish the Office of Disability Employment Advancement and Policy in the Department of Disabilities. The work of this proposed office will build on the coordinating functions that we have provided to increase employment opportunities for people with disabilities since the establishment of our department 21 years ago. This coordinating function is clearly defined in our statute. This office will oversee what is referred to as the State as a Model Employer Initiative, and we also refer to that as SAME. State governments play an important role in advancing the recruitment, hiring, retention, and advancement of people with disabilities through their own employment policies, thereby serving as a model for the private, non-public, local government, and municipality sectors. Maryland state government has long been seen as a leader in SAME with our disability hiring preference, the special options eligible list, the pre-pandemic and post-pandemic telework policy, and the DOORS Quest program. However, we believe that more needs to be done to make state employment a realistic goal for people with disabilities, people that are qualified. The best work can't be done in silos, and so a coordinated effort seated with a state department that's charged to work collaboratively across state agencies is planned. This effort will be tightly coordinated with our other state agency partners whose work centers on assisting and increasing employment opportunities for people with disabilities. These include DBM and their Office of Personnel Management and Benefits, the Department of Labor, the Department of Health, including DDA and BHA, and MSDE, the Division of Rehabilitation Services. To avoid any overlap, these and other partners were involved in the planning of this initiative and are prepared to support the work should the legislation pass. This new office will work with state agency partners to provide training and technical assistance and identify vacancies and potential job seekers. And at the same time, we will work with the community to do outreach and provide support to individuals with disabilities that are interested in state employment. We currently have a Director of Employment and Transition Policy, and her work is the foundation upon which the Office of Disability Employment Advancement and Policy will be integrated. This legislation that establishes the office requires no funding for FY26 and will be absorbed within the department's current workforce. We will use FY26 as a planning year with our state agency partners. I'm really grateful to the governor and to the lieutenant governor for their wonderful leadership on this issue, which is of such importance to people with disabilities in Maryland. In closing, we respectfully support the recommended action to concur with the governor's allowance, and we'll be glad to take any questions that the subcommittee members might have.
Senator Zucker.
Thank you. Thank you very much, Madam Secretary. Thank you to you and your team for doing an amazing job. It's interesting. I was talking to Ms. London during the interim, and you've got such a great coalition around you. And one of the thoughts I had was to create like an internship for those with developmental differences in all the state agencies. C.T. Wilson and I passed something like that for foster youth. We ultimately didn't put the bill in just because we want it to be successful for the men and women, the individuals who have developmental differences to succeed in this area. But I guess one is there something we can be helpful with toward the effort of, I believe it's SAME, is that?
SAME,
yeah.
yes. Mm-hmm.
And then one is there anything we can be helpful with? Two is the thought of this internship program, would that fall in line with SAME, or is it, no pun intended, different?
That's a good one. That's a great question, Senator Zucker. Great two questions. Number one, you can support the bill. That would be wonderful. And then as we move forward, assuming, but not overly assuming that the bill will pass, but if it passes, the planning year will be incredibly important, and we'd love to have your thoughts as well as others. Your program the program that you mentioned sounds like Project Search, which is a program that is for students in their last year of high school. I know you're familiar with this program because you have Project Searches in Montgomery County. And yes, of course, that is one way, one tool that we might use in order to implement this program. That idea also aligns very, very nicely with the Quest program that DOORS operates. And we are, again, wanting to, during this planning year, wanting to take a look at the Quest program because it was very successful for many years, but has sort of slowed down, and we want to see why and figure out some ways to tweak that program.
Madam Secretary, seeing no more questions, I do want to just say thank you for your leadership across the state of Maryland. We do have one private witness that we want to bring up before we wrap this hearing, and that is from the National Federation of the Blind.
Okay.
Thank you.
Thank you. Good afternoon, Mr. Chairman and members of the committee. I'm Jonathan Mosen, and I'm Executive Director for Accessibility Excellence at the National Federation of the Blind. And I'm here to speak in support of the continuation of the Non-Visual Access Initiative Agreement that is a part of the budget for MDOD. There are a number of aspects of this grant that I want to talk about. It has been in place since 2014 when our Centre of Excellence in Non-Visual Accessibility was founded. And it is a centre of expertise, best practices, training and resources that enable businesses, government and educational institutions to provide accessible non-visual information and services to blind citizens effectively and efficiently. This in turn gives blind and low vision citizens a better chance to succeed at work, at school and in society. This grant is an investment in the capacity building of people with much to contribute as long as the accessibility barriers come crashing down. The grant has specific areas of focus, and they are education, employment, training, both for blind and low vision people and those who may provide services to us, smart cities, and a Disability Inclusion Fellowship program. The NVAA grant assists those who know that making documents accessible is the right thing to do, but they don't necessarily know how. And just 3 days ago, we held another successful webinar showing people how to produce accessible documents. It provides a range of other guidance to those who want to engage accessibly with blind and low vision people. There's also a dizzying and exciting range of technological choices available to blind people these days. And it's a full-time job keeping up with all of this technology innovation. I can tell you that because it's mine. Smartphones and computers have technology built in that speaks what's on the screen or sends it to a braille display. Artificial intelligence is changing the world, and blind people aren't left out. Using the camera on a smartphone or a computer, AI can now assist with many visual tasks, such as describing pictures or reading labels on inaccessible packages. And now, AI is emerging that can even describe our environment to us as we walk down the street or navigate an unfamiliar building. But without the NVAI grant, it would be difficult to find quality advice about choosing the right tool in the toolbox. And there are more choices emerging all the time. There is some exciting innovation taking place in our smart cities category, where we're seeing technology being developed providing quality navigation when in buildings that a blind person may not have visited before. And while GPS technology is now mature, indoor navigation is an area where the NVAI grant is adding value. Even in the short time that I've been here, and I've only been in Maryland for a month from New Zealand where the weather was hot, I have learned how many people across the country look with envy at the NVAI grant and what it delivers in Maryland. And we have exciting plans to inform and empower through this public-private partnership, and the continuation of the NVAI grant will ensure that we can make a difference for blind and low vision people and those who want to provide accessible services. So thank you for your consideration and your time.
And thank you. Seeing no questions, I'd just like to thank you all for the work that you do. Like I said, for all of Marylanders, not some of Marylanders. Madam Secretary and Mr. Mosen and Ms. Andrade, just thank you for the excellent readout. Colleagues, at this time, if we can move to the next agency, which is the Department of Aging, and we'll ask Ms. Victoria Martinez to come up.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez, and I will be discussing the Department of Aging budget analysis today. The Maryland Department of Aging functions as the federally designated state unit on aging and receives federal and state funding that is distributed to 19 local area agencies on aging who provide services to older adults, such as information and referral services, meal delivery services, and assisted living subsidies. Starting on the first cover page, the fiscal 2026 budget decreases by $869,000, or about 1%, to $990.3 million. The fiscal 2026 allowance includes one deficiency that totals to a $1.5 million increase in the fiscal 2025 appropriation to provide funding for several programs. Turning to the overview of agency spending on page 4, this exhibit shows an overview of the agency's spending for the fiscal 2026 allowance. The majority of the budget goes towards various state and federal funded programs. The two largest shares include various federally funded programs through the Older Americans Act that accounts for 28% of spending, and the state-funded senior care program, which accounts for 15% of agency spending. On the next page, Exhibit 2 shows what is driving the change in the budget. The two largest decreases were $913,000 due to the expiration of ARPA stimulus funding and a decrease of $682,000 in the senior care program. This exhibit also shows various other changes in the fiscal 2026 allowance, including changes relating to funding to local AAAs, new initiatives, and programmatic and administrative changes. Moving on to Exhibit 3 on page 7. This exhibit shows the various community services programs that are funded by MDOA and mainly administered by the AAAs. The vast majority of programs were level funded and showed no change in funding in fiscal 2026. Going on to personnel at the bottom of page 9, the fiscal 2026 allowance includes one new position that is for information technology support and 6 contractual conversions, which provides for a total of 56 regular positions and 3 contractual positions. Moving on to the key observations on page 10. The first key observation discusses a departmental bill that would consolidate 3 of MDOA's community programs, including senior care, senior assisted living subsidy, and the congregate housing services program to facilitate managing the programs as one singular program to make them more flexible and accessible. These programs provide financial support and case management to older adults to allow them to live independently for as long as possible and to avoid costly stays in nursing facilities. Key observation 2 on page 11 is on the senior care program waitlists and participation. Exhibit 4 on page 12 shows the senior care participation and waitlist size from fiscal 2022 to 2024. In fiscal 2024, the waitlist continued to increase while participation in the program decreased. Exhibit 5 on the next page shows both participation and waitlists in the program by jurisdiction. Those with the highest waitlist include Baltimore City, Frederick, Wicomico, and Charles, and for each of these, the number of individuals on the waitlist was larger than the number of participants in the program. Exhibit 6 on page 14 is a similar chart that's broken down by jurisdiction, but shows the change in participation and waitlist from fiscal 2023 to 2024. As shown, the number of participants decreased in all jurisdictions. And DLS has asked that MDOA explain why participation in the senior care program in fiscal 2024 decreased while the waitlist continued to increase, and to also discuss efforts to efficiently enroll individuals from the waitlist into newly open slots. In terms of funding for the program, $8.5 million was added by the General Assembly in fiscal 2024 to address the growing waitlist, but there have been challenges with spending the increased level of funding. Exhibit 7 on page 15 shows the funding for the program. MDOA reverted about $5.9 million of senior care funds at fiscal 2024 closeout, resulting in actual spending of $8.7 million. The program is funded at a much higher level of $13.9 million in fiscal 2025 and $13.2 million in fiscal 2026. MDOA and AAA's reported various challenges in spending the funding in fiscal 2024, mainly regarding uncertainty about the sustained level of funding, but also including unclear guidelines since the increased funding was not planned, and administrative barriers such as lengthy processes for authorizing spending. Due to the fiscal 2025 working appropriation reflecting a level of funding more than $4 million beyond actual fiscal 2024 spending, DLS recommends reducing $2.5 million for the program to better reflect actual spending in recent years. This reduction would allow for a more gradual increase in funding from $8.7 million spent in 2024 to $13.2 million spent in the 2026 allowance. Moving on to the third key observation on page 16, this provides an update on 2 recently created initiatives. The first is a long-term care and dementia care navigation program that was established by legislation in 2023 and provides support to persons living with dementia. In terms of funding, there is a $2.4 million mandate for the program, but this was reduced by $1.2 million in fiscal 2025 by the Board of Public Works. The fiscal 2026 budget includes a reduction of $1.2 million for the mandate that is contingent on the passage of the Budget Reconciliation and Financing Act of 2025. Regarding the implementation of the program, MDOA submitted an annual report which discussed the program's vision, goals, structure, and organization. Exhibit 8 on page 18 lists the 7 established goals and the department's progress towards each of these goals. The second initiative is the Longevity Ready Maryland initiative that was established by executive order in January 2024 and requires MDOA to develop a multi-sector plan to guide systems transformation over the next 10 years. The department plans to share the final plan and recommendations with the Governor and General Assembly in July 2025. The discussion on page 19 summarizes some of the activities related to this initiative. Some activities that I'll highlight include the formation of work groups to address priority areas and the data dashboard that has been in the works and is set to launch a final version in July 2025. The last key observation that I'll discuss begins on page 20 and is related to the Task Force on Preventing and Countering Elder Abuse. As required by legislation in 2023, MDOA established a task force to conduct a review of issues relating to abuse, vulnerability, and exploitation of the older adult population in Maryland. The task force submitted a final report with its findings and recommendations in December 2024. These recommendations are summarized in Exhibit 9 on page 21, and DLS has asked MDOA to discuss their plans to implement these recommendations. And with that, I'll conclude my presentation, and I'm happy to take any questions.
Thank you. Seeing no questions, if we could bring up Madam Secretary.
Good morning, Chair McCray and committee members. I want to thank our analyst, Ms. Martinez, for the wonderful collaborative work that she's done with us to produce this analysis of our budget. Up here with me is Maryland Department on Aging CFO Michael Zomber, Jennifer Crawley, our Deputy Secretary, and Elaine May, Assistant Secretary for Grants Administration. I am Carmel Roque. I am the Secretary of Aging, and I am very, very happy to be here with all of you today. Our fiscal year 2026 budget reflects the challenges and the opportunities of serving Maryland's aging population, close to 2.4 million people today, and significant work towards building a sustainable, cost-effective network of services and supports for the future. This budget reflects our values, our underlying principles, and the ongoing work of reaching our aspirational goal of all older Marylanders leading healthy, financially secure, socially connected, and purposeful lives across the full life course, which we now know can be easily up to 100 years. Half of all the 5-year-olds alive today can expect to live to be 100. The work of our agency falls into two functional but interrelated areas: grants administration for federal and state funds, and our planning, policy, legislative, and advocacy role. Over the year, we've made progress building our agency's capacity to meet our mission by recruiting and hiring experienced staff to serve in key positions, and you heard that we today have in the 2026 budget 56 regular PINs and 3 contractual staff. As of today, we have 3 vacancies in staff positions in the agency, significantly down from the 30% vacancy rate 2 years ago. Bolstered by some of our new in-house hires and our outside technical assistants, we've conducted programs and fiscal analysis across all of our program areas, as well as extensive stakeholder engagement, so we can best determine what we're doing that works well to serve older Marylanders, their families, and their care providers, and what needs further improvement. As a result of that engagement and data assessment, we have 2 departmental bills, which you heard about in our analysis, that are designed to modernize 4 state-funded programs for older adults, expanding the ability of older people to live in their homes of choice. MDOA also has seen our competitive grant-seeking opportunities pay off significantly for the benefit of the aging network and growing promising evidence-based models and interventions to support older people. We receive federal funds in partnership with our sister agencies and the Aging Network partners to expand our work capacity around caregiving with the work toward in transitional housing and permanent housing, people who are unhoused. We know that the fastest growing element of people unhoused in the state are older people. And we also are working on the Community Aging in Place Advancing Better Living for Elders model, which will be launched in the coming year. Bringing together the right partners and supporting the growth of these kinds of models, once they are shown to be effective, could lead to additional state-supported growth of these interventions in the future in partnership with the Aging Network. I'll note we've been very, very busy with stakeholder engagement, both for drafting the Longevity Ready Maryland Plan, the 4-year state plan, but also in this assessment of our programs and services over the last year. Finally, we are all aware of the state's budget climate, and much of the department's work this year has been directly responsive to those challenges, focused on achieving greater efficiency with our existing state funding. We want to stretch the existing funds we have currently to better serve more older Marylanders with useful services when and where they need them. The cuts we absorbed this fiscal year through the governor's reductions during the summer through the Board of Public Works, you all see it reflected in our proposed fiscal year 26 budget. These represent reasonable adjustments to our newest programs and where reductions would be least impactful to ongoing services for older people. DLS's additional proposed $2.5 million cut to the senior care program in fiscal 2025 will be very destabilizing. It will reduce staffing and direct service availability for older adults living in their homes statewide. At the AAA level, these fiscal year 2025 senior care funds have already been planned for and spent. And so further reduction this year will have significant consequences at the local level. These state funds are more critical than ever, as our federal funding through the Older Americans Act is at risk, and we could find our ability to provide essential services, such as nutrition, transportation, and home care, seriously compromised. For example, our federal nutrition dollars provided 3 million meals this past year for older Marylanders. In closing, I'm confident that in partnership with you, we can work our way out of this year's budget challenges and move forward in an efficient and effective way to preserve the department's ability to support, advocate, and plan for older Marylanders. And with your permission, I would like to ask if our CFO could add a few clarifying contextual suggestions.
Good morning, Chairman and members of the committee. To reiterate some of the points made by Secretary Roque, MDOA opposes the DLS proposed FY25 cut to the senior care program. The FY26 cut of $700,000 in senior care spread across our 19 AAAs is manageable. However, the proposal to cut an additional $2.5 million in the program in the current fiscal year would be potentially devastating. It's true that in FY24, senior care funds were significantly underspent, but that was due to an infusion of new waitlist funds for which the AAAs weren't fully prepared, and the AAAs were hesitant to make substantial investments in the program when there was uncertainty about the continuity of that funding. In FY25, AAAs have already made hiring decisions and programmatic investments on the basis of the allocated funding levels. Moreover, during our mid-year fiscal reviews with the AAA network, we've consistently heard that senior care funds are being fully utilized and that additional funding would allow them to serve more individuals. Any savings the state might achieve from reducing this program in FY25 would come at the direct expense of the low-income beneficiaries who rely on this critical support. The deliberation of our budget occurs against the backdrop of serious fiscal challenges facing MDOA, not the least of which is uncertainty about the continuity and timing of federal funding. Now that more than ever, it's crucial that our AAAs have the confidence and assurance of consistent state funding support. Thank you.
Is that everything, Madam Secretary?
Yes, it is. Thank you.
Yeah. Seeing no questions, but just I heard your CFO, I heard you. I guess the level of communication that may not have been existent in the previous year, you're assuring us that that level of that communication has taken place with the AAAs to make sure that these resources, because that's what it sounded like. If they didn't have assurances, they didn't feel like the continuity was there, it must have been some level of a communication challenge.
The wait list funding was one-time funding, and they were aware that it was one-time funding, and it made them reluctant to spend because then they would have hired staff and begun to serve more people. So we did do some work during the year to try and make the waitlist funding more readily available. But I think thank you for that question, by the way. I think the important thing is to recognize that the department has spent a lot of effort in trying to identify where are the pain points, what's interfering with effective and efficient use of funds. And it's one of the reasons why we have the proposal to modernize our programs, because we've talked both very honestly and openly and a great deal with our area agencies on aging to try and understand how can we better support the network in being able to use this funding to serve older Marylanders. And I think we have good plans in place and more work to do.
Yes, ma'am. Seeing no further questions, Madam Secretary, we do have folks that are going to give public testimony. At this time, Stella Mars, Home Health. We'll ask Maryland Association of Area Agencies on Ages and the Alzheimer's Association.
Good afternoon, Chair, members of the committee. My name is Megan Peters, and I am the Director of Government Affairs for the Alzheimer's Association in Maryland. Dementia is a growing public health concern in Maryland. We know our prevalence is high, the cost of care is substantial, and it takes a devastating toll on our caregivers. The programs and services offered through the department are vital to meeting the needs of our older adults, including people living with dementia, and I thank this committee's support over the years in funding those critical services. We recognize the state's budget climate and the uncertainty surrounding future federal funding. And as we look into this future, it's important to continue to invest in programs for our older adults because they can lead to long-term savings. As introduced, the governor's budget protects the majority of funds for existing department services, except one key program, the Long-Term Care and Dementia Care Navigation Program. Today, I'm urging you to protect and restore this funding as it is at risk of permanently being cut in half. The program was enacted in 2023 and has a mandatory appropriation of $2.4 million annually. And the Budget Reconciliation Act, as introduced, includes language to permanently reduce that appropriation to $1.2 million each year. While the governor did cut current fiscal year funding this year, it will be devastating to continue this cut into the future. This program helps caregivers navigate the complex maze of dementia care and has been shown to reduce healthcare costs and improve quality of life. If we don't address this issue now, we know that the strain on Medicaid will only increase as our population continues to age. In 2020, Maryland Medicaid costs for people living with Alzheimer's was $1.2 billion, and the average per person Medicaid spending for people living with dementia is 22 times greater than those of people without dementia. If you or someone you know cares for a loved one with dementia, you know how significant this diagnosis is. Care navigation allows for better care coordination and reduced strain on our caregivers and our healthcare system. This program will benefit the state in the long term, and I urge the committee to protect this funding. Thank you.
Good afternoon, chairs and members of the subcommittee. Thank you for your service to our great state and the roles you all have taken on regarding health and human services. Everyone knows it's a tight budget year, and your decisions will be incredibly difficult as many programs will be affected by a decrease or loss in funding. However, the Maryland Reuse Durable Medical Equipment Program is one that pays for itself many times over. I'm here to represent and speak on behalf of the wonderful people of West and Southwest Baltimore City and the life-changing work that the Reuse DME program has had on these people. My name is Joe Holmes, and I'm a home health physical therapist in Baltimore City, going into strangers' homes who are at the highest level of service needs and are truly homebound. The majority of patients we see are either physically unable to get out of bed, up or down stairs, and not able to get in or out of their homes. These people require DME that is beyond the scope of what their insurance will cover, and for almost all the people we see, buying medical equipment out of pocket is not an option. Items such as shower chairs, toilet rails, even wheelchairs, walkers, and hospital beds many times are not covered by even the best of insurances. The Reuse DME program has allowed countless numbers of people to stay in their homes and prevent loved ones from either spending the money that they don't have or taking the fight to insurance companies that they are very likely to lose. We have a gem in the state of Maryland, which is this Reuse DME program. And I think so highly of it that I actually connected the program to a pilot project at the University of Maryland School of Medicine to provide DME to the West Baltimore residents in need. I'm originally from the Midwest and I'm a transplant to Maryland. And I tell anyone and everyone I know in other states that our tax dollars go to tremendous work in Maryland in paying for a program such as an innovative program like the DME Reuse program. This is a program I'm honored to tell everyone about that we have. And I'm very proud to be a Marylander because of it. Thank you all for your service, your time, and your love of our state. And I hope to see just how much this program means to you as it does to us.
Good afternoon, everybody. I'm Ann Seacott, and I'm representing the Maryland Association of the Local Area Agencies on Aging. We want to say thank you to the waitlist money that you all spearheaded a couple of years ago. And I want to tie that to the recommendation to reduce the funding. I thought Mr. Zumber did a great job and the Secretary did a great job of talking about why it was difficult to spend that money. When it was believed to be one time only, the AAAs were loath to hire staff without a guarantee they'd be able to keep them on or bring people onto services just to have to take them off. So some jurisdictions did a good job of spending that money on one-time expensive things. Others just weren't able to do it. And there were also complications at local levels about getting approval for spending money differently. As you heard very clearly, they are now, the AAAs now, knowing that there's confidence the money's going to continue, they are spending it. In 2024, the AAA spent 98% of their base dollars. They are fully capable of spending the money that's been appropriated in the governor's budget, and we very much ask for you to protect that money. We do share the disappointment with Alzheimer's Association in the reduction of money for the dementia care program. We do believe that there are some of the AAAs have established programs and they can do more with more money. Others are really at the beginning setting up these programs. So to reduce that money will just make it more difficult. You've seen the data about the growing wait lists for senior care, about the growing aging population, and about the truly scary numbers in Maryland in terms of Alzheimer's and dementia diagnoses. And so we really do ask you to do what you can to protect those dollars.
Thank you all. Seeing no questions at the time, I just wanted to thank you all for your public testimony. Madam Secretary, I just wanted to thank you again and thank you for the elaboration on the cut that was presented. And also, Ms. Martinez, just thank you all the time. As the Secretary has stated in reference to the phenomenal readout and just the collaboration with the respective agency. Colleagues, at this time, we're going to call up the next agency, and that's going to be the Department of Human Services overview.
Hi, I'm Suveksha Bujel, and we are here to present the Department of Human Services budget overview. Before I get started, I would like to request my fellow DHS analysts to introduce themselves.
Tanya Zimmerman, I'm here as the analyst for the Family Investment Administration.
I'm Natalia Andrade. I'm the analyst for DHS Administration and DHS Child Support Administration.
Okay, I'm going to begin on the first chart on page 2, which provides the overview of DHS budget by fund type. In total, DHS allowance in fiscal 26 is $4.2 billion, which is an increase of about $55.1 million or 1.3% from fiscal 25. As you can see, the majority of budget is made up of federal funds. The largest component, the orange section on the chart, represents the Federal Supplemental Nutrition Assistance Program funds. There is a small portion on the top of the chart broken out to show the Federal Electronic Benefit Transfer. The green portion shows the remaining federal funds. Moving on to the pie chart on page 3, it shows the functional breakdown of spending for fiscal 26. Over half of the DHS allowance funds public assistance payments, which is about $2.2 billion. The second largest portion is for personnel expenses, which is about $659.8 million, or 16% of the budget. The third largest portion is for foster care maintenance payments, which totals about $395.6 million, or 9% of the total budget. The remainder of the budget funds the administrative and programmatic expenses for other divisions within DHS. On page 4 is the higher level overview of the budget for all fund types. The chart also breaks out the funding for the federal SNAP and Sunbucks at the bottom. The total funding for these two programs is approximately $1.9 billion, while the remainder of DHS budget totals $2.2 billion. By fund type, general funds in DHS total $1 billion, special fund totals $229.7 million, federal funds, excluding SNAP and Sunbucks, total $957.2 million, and reimbursable funds total $33 million. By program, the largest funding goes to Social Services Administration, about $791.2 million, and Family Investment, excluding SNAP and Sunbucks, $706.5 million. On page 5, we have the breakdown of general funds portion of the budget. The total general fund allowance in fiscal 26 is about $1 billion, which is an increase of $90.1 million, or 9.8% from fiscal 25. Accounting for fiscal 24 deficiency, this difference comes down to $19.3 million, or 1.9%. The majority of general funds are dedicated for Social Services Administration and Family Investment. Moving on to deficiency appropriations on page 6, the fiscal 26 budget proposes deficiency appropriation totaling $200.1 million across the entire department, which includes $99.1 million in general funds. The largest fiscal 25 deficiency appropriation replaces $64.3 million in assistance payment programs that was reverted in error during fiscal 24 closeout and is needed to cover fiscal 24 expenditures. Moving on to proposed budget change chart on pages 8 and 9. As I mentioned earlier, the total budget for DHS increases by $55.1 million in fiscal 26. Of this, personal expenses accounts for an increase of about $31.9 million. This includes salary increases, associated fringe benefits, and also includes the cost of living adjustment. Program-wise, the Office of Home Energy Program has the largest increase of $55.9 million, which also includes the Strategic Energy Investment Fund allocated for energy assistance. DHS administration's budget increases by $23 million, which includes funds for MD Think system, Budget for child support administration increases by $5.5 million, and for family investment administration by about $1.1 million. For foster care maintenance payment, there is an increase of $7.2 million. There is also an one-time deficiency related to fiscal 24 shortfalls, which is about $8.1 million. There is a decrease of $1.4 million in social services administration, and assistance payments is a decrease of $67.6 million, which is primarily due to the one-time deficiency appropriation related to fiscal 24 shortfalls and replacing funds reverted in error. On page 10, we have the caseload estimates assumed in the budget. The temporary cash assistance is assumed to decrease by 3%. TCA transitional benefit is assumed to decrease by 23%. Temporary disability assistance payments, foster care, subsidized adoption, and subsidized guardianships are assumed to remain constant in fiscal 26. SNAP supplemental benefit is assumed to increase by 2%, and federal SNAP cases to decrease by 3%. The total child support collection is assumed to increase by 1%. On page 11, we have the personal data. Overall, there is no change in total regular and contractual positions in DHS. Next section, we will talk about 4 issues. Tanya Zimmerman will take over to discuss the first 2.
Thank you. The first issue is related to some closeout issues. As you may have heard, as part of the deficiency appropriations, there were several deficiencies related to this. So during the fiscal 24 closeout process, the department made several errors, including reverting general funds in error, spending on entitlement programs greater than the appropriation without reporting this as required, and incorrectly reporting expenditures both in total and by fund source for the entitlement programs. Exhibit 1 on page 13 presents a chart showing the total fund spending that was reported to the comptroller, as well as the total fund and general fund spending that was reported in the fall of 2024 to the Department of Legislative Services and the Department of Budget and Management. In total, the department reported about $35 million higher of assistance payment spending to the comptroller than it actually intended to expend, and $8.1 million less in the foster care maintenance payments program than they intended to spend. Among both fund sources, among both programs, however, they reported more federal fund spending than actually occurred, but for general and special funds, it was lower than what they expected, which I'll delve into a little bit more in a minute. Throughout the fall of 2024, the department was unable to reconcile the expenditures reported to the comptroller by benefit program and the assistance payments program, and inconsistently reported the expenditures by fund source within the program. And they have also not provided sufficient information to describe the reason for the higher expenditures or a new fund source in the foster care maintenance payments program. Throughout the fall, the department was delayed in responding to questions about its closeout, and as of this writing, has not yet responded to some of those questions, including the cause of the increased expenditures and in the foster care maintenance payments program, as well as some fund sources, or provided a complete explanation for the cause of the errors in the reporting to the comptroller. Specifically on the general funds, between the 2 programs, the department had a combined shortfall of about $108 million from what they reported to the comptroller and what they intended to spend. About $90 million of that was in assistance payments, including the $64.3 million that was reverted in error, which the department indicated was due to misreporting federal general fund expenditures as federal funds. They were also spent about $26 million more than the available appropriation, which they did not report to the comptroller. That was due to higher than expected caseloads in various programs, primarily in the Temporary Disability Assistance or TDAP program, as well as the allocation of general and federal funds for the Temporary Cash Assistance Program or TCA that was different than expected. The $18.6 million difference in the reported expenditures in the foster care maintenance payments program was primarily due to not having sufficient appropriation to meet the expenditures, though the cause of the increase appears to be related to flexible fund spending, and we'll discuss in issue 3 the likely cause of that. Overall, aside from the reversion in error, the department reported about $4 million of other reversions that were not in error. Most of that would have been available to be transferred to the programs that experienced shortfalls to at least partially offset them, and it's unclear why that did not occur or why they did not report the over expenditures to the comptroller. Subsequent to the initial reporting of the expenditures to DLS and DBM, the department indicated that federal TANF funds could be used to cover a portion of the general fund shortfall in the TCA expenditures and is being used to cover all of the foster care maintenance payment shortfall, both through a deficiency appropriation and restating its fiscal 2024 expenditures. In total, the deficiency appropriations to cover fiscal 24 expenses total about $80 million, about $72 million of which is general funds. Among the special funds, the department reported lower special fund expenditures than they indicated that intended to occur, about $1 million for each the assistance payments and foster care maintenance payments program. In the assistance payments program, they actually had sufficient appropriation, but had transferred funds and canceled the remaining, even though they had needed some of that to cover what they intended to spend. For the foster care maintenance payments program, they did not have sufficient appropriation, but if they had revenue to support it, they could have brought in a budget amendment. Given that they've subsequently used all federal funds to cover the shortfall, they may not have actually had the revenue to support the expenditures they intended. And we've asked the department to discuss their plans to improve their closeout process to ensure that reporting to the comptroller reflects their actual expenditures and the shortfalls are reported as required. And the department will also, the Department of Legislative Services will also make a recommendation related to the reporting of closeout information in the Family Investment Administration analysis. The second issue is related to the TANF spending and balance. The department has received, primarily receives funding from TANF through a block grant, which is largely unchanged since the program's initiation, and they've received about $228 million since fiscal 2017. The state also receives contingency funds related, which are available to states based on SNAP participation or unemployment compared to prior periods. The amount has varied from year to year, but was about $26 million in fiscal 2024, similar to what they've received in prior years. If you turn to page 16, this begins the discussion of the TANF balance. So between fiscal 21 and 2022, the state replaced about $140 million of planned TANF spending on cash assistance with state fiscal recovery funds from the American Rescue Plan Act. The purpose of this was to assist the state with a higher than expected caseload during COVID, as well as allow the state to retain TANF balance for future years. This was expected to lead to higher general fund spending in those years, but would reduce general fund spending in future years when general funds were less available. The department ultimately spent more TANF in fiscal 2022 and 2023 than was expected, reducing the balance below what was expected when that fund swap occurred, and therefore they used the balance, a portion of the balance, in years where general funds remain plentiful, which has reduced their availability beginning in fiscal 2026 when the state is experiencing significant cash and structural shortfalls. Page 2 presents the data on the balance, current balance. At the close of fiscal 2024, the balance had actually increased compared to 23 by about $10 million. I should note that the 24 expenditures used throughout this issue are based on the restated expenditures and do not match what's in the governor's budget books. And the increase in the balance was largely due to spending less than expected in several programs. However, the balance at the close of fiscal 2025 is expected to decrease by approximately $50 million because of the use of TANF to cover both some of those fiscal 2024 shortfalls, as well as covering shortfalls in fiscal 2025 for TANF or for TCA, where it's covering the entire shortfall that's projected of about $11 million, as well as about $15 million of the $38 million shortfall in the foster care maintenance payments program. The remaining decline is related to our previously planned higher expenditures in the foster care program. The balance decreases a little bit further with the fiscal 2026 allowance, and so the state is really going to have to start aligning their TANF spending within the available appropriation as the balance is largely eliminated. Exhibit 3 presents information on the TANF spending in recent years. Overall, TANF spending decreases by about $47 million in fiscal 2025, and that's really driven by those deficiencies to cover the shortfalls in the foster care maintenance payments program and the assistance payments program. Despite the significant increase or decrease, the funds still remain higher than other recent prior years. Exhibit 4 on page 20 presents information on the share of the TANF spending that is for cash assistance. That decreased in those years in 21 and 22 and 23 when the state used more general funds use some of the federal funds from the ARPA in lieu of the TANF funds, but has returned to historical levels. Exhibit 5 on page 21 presents the share of TANF spending on child welfare purposes. As you can see in this exhibit, the share of TANF spent on child welfare purposes has increased significantly since fiscal 2015, with particularly large growth after fiscal 2019. The share of the spending on the child welfare services, including kind of caseworker spending, did return down to more historical levels in 2024, which they are projecting to continue through fiscal 2026. The foster care spending really increased beginning in fiscal 2020 and has been above $30 million in most years since then. The spending in fiscal 2025 is driven by those shortfalls, the additional spending on shortfalls, and is reduced in the fiscal 2026 allowance, but still is much above the historical levels. And with that, I will turn it back to Sudichka.
Thank you. The third issue talks about the children in out-of-home care placed in hotels. Exhibit 6 on page 23 displays the number of children in foster care that are placed in hotels in fiscal 23, 24, and year-to-date fiscal 25. 154 children were placed in hotels in fiscal 23 and 180 children in fiscal 24. DHS reports that fiscal 23 numbers might not account for all the children placed in hotels due to the absence of a formal data collection process. This is reflected in the increase in number of children placed in hotels in fiscal 24 following the implementation of a formal data collection process. Exhibit 7 on page 24 shows the average length of stay for children placed in hotels. In fiscal 23, the average length of stay was 75 days. In fiscal 24, it decreased to 68 days. And in fiscal 25 year-to-date, it is at 66 days. DHS estimates the cost per child per stay to be about $96,000. The expense for children placed in hotels is accounted under flexible funds, independent living, and promoting safe and stable families. Exhibit 8 on page 25 shows the expenditure for these categories has been increasing in the last 2 years, particularly for flexible funds. While improved reporting may account for some of the increase in number of children placed in hotels, the increase in spending in these categories indicate that the number of children placed in hotels has increased. DHS should discuss the situation in which children are placed in hotels and the efforts made by the department to reduce placements in hotels. DLS also recommends adding language in fiscal 26 budget bill. This recommendation will be included in the analysis for DHS Social Services Administration. On page 26, we have the fourth issue. During fiscal 24 closeout process, DHS provided delayed responses and was unresponsive to certain requests from DLS. In addition to this, DHS has been delaying in submitting responses to report requests contained in the Joint Chairman's report. As shown in Exhibit 9 on pages 26 and 27, of the 18 reports requested from DHS, only one was submitted by the due date. As of January 18, 2025, there are 4 reports outstanding. DHS should comment on the measures that it is taking to improve the timeliness of submissions of reports and other requested information. That concludes our presentation, and we'll take any questions you may have.
Senator Zucker.
Thank you very much. Thank you for that, everybody, for the thoughtful analysis. Do we know, be happy to hear from the administration, do we have the age breakdown of those children that are in the hotels?
We do not have that information as of now.
No problem. Well, we will soon, though, I'm sure. Thank you.
Seeing no further questions, at this time, I'd like to bring up our agency, DHS, and Madam Deputy Secretary, Acting Secretary.
Good afternoon, Chair McCray and members of the committee. For the record, my name is Carnitra White, and I serve as the Principal Deputy Secretary for the Department of Human Services. And I would like to thank Governor Moore, Lieutenant Governor Miller, and our colleagues at the Department of Budget and Management and the Budget Committees for their support. We're grateful to the Department of Legislative Services and our analysts for their support as well, and for the analysis. We have 3. And joining me with at the table today is our Acting Chief Financial Officer, Jessica Smith. We also have members of our leadership team in the audience, including our Director of Social Services from Cecil County, Lisa Beeman. At the Department of Human Services, we are honored to serve more than 1 million Marylanders. We serve to ensure that every Marylander can reach their full potential by providing preventive and supportive services, economic assistance, and meaningful connections to employment development opportunities. Our team consists of 6,000 state employees across our 24 local departments of social services who administer 80% of all activities in our $4.2 billion budget, of which 69% is federally funded. To do this work, we must deploy these resources strategically. And to do this work well, we must hold ourselves accountable to a high standard of excellence in customer service. We acknowledge that we continue to face major challenges in our efforts to modernize DHS. We continue to discover deeply embedded issues such as our fragmented data reporting approaches with manual or outdated processes. To meet these challenges, we continue to invest in our people, policies, and practice. Over the past year, we have conducted a systematic rebuilding of our teams and functions, including a particular focus on our Office of Budget and Finance. For example, for the first time in 2024, we were able to load our detailed financial data into the Financial Management Information System. This allowed us to manage according to our budget and track spending. Prior to FY25, DHS did not utilize detailed allocations in FEMAS. We have continued our efforts to rebuild state government in a responsive and sustainable way. On December 31st, 2024, our vacancy rate was 7.97%, a decrease of 7.23% from January 2023, when our vacancy rate was 15.2%. Now, if you allow, I will share some highlights of our work this year, and then we will respond to the issues that were brought up in the analysis. This past summer, we launched the Maryland Sunbucks program, and I would like, this would not have been possible without your support, so I would like to thank you for your partnership in launching that program. And summer 2024, we distribute $120 in direct benefits to every eligible child across the state, making it the largest investment in Maryland's history to address summer hunger. We innovatively and seamlessly implemented the new Sunbucks program to help families achieve greater nutrition, access, and equality. It took 52 days from when the legislation was signed into law to when meals funded by this program were on the kitchen tables in our state. This past summer, the new Sunbucks program served over 594,000 children in all 24 jurisdictions in the state of Maryland. This represents a 6.5-fold increase from the previous year. This was a significant undertaking, and it was successful because of the unprecedented cooperation across state governments, including our partners at the Departments of Education, Health, and the Health Benefit Exchange. This is a clear example of how when we work together to achieve, we can achieve enduring results for the people we serve. And I'm pleased to share we will maintain the program in 2025, and we'll discuss more about the Sunbucks program during our Family Investment Administration budget hearing. Next, I want to talk about something that I think we all can relate to, family. Last year, with your partnership, Senate Bill 708, Kinship Care, was enacted. The Kinship Care law prioritizes kin placements, broadens the definition of kin to include family members, close friends, and those connected through cultural and tribal ties. Research shows that children who are placed with family members are more likely to maintain their relationships with siblings, experience fewer placement disruptions, and show better mental health outcomes. The connection to family, community, and culture is vital to a child's development. In essence, family matters. Family Matters is not just a policy shift, it's a cultural shift, a shift that centers family and community in the lives of our children. Today, only 27% of children in Maryland in our foster care system are placed with kin, and we know that we can do better. We will partner with Maryland families to prioritize kinship placement for youth, support kinship caregivers, and strengthen lifelong bonds. Together, we will ensure that children in Maryland grow up with support they need to thrive. Next, I'm going to talk a little bit about the Unified Benefits Screener, which was launched in December. We partner with our colleagues at the Department of Information Technology and the Department of Health to announce the launch of our Unified Benefits Screener just last month. This tool on MyMDThink enables Marylanders to determine their eligibility for critical support programs in just minutes. As of January 23rd, the Benefits Screener has already helped Marylanders complete 42,865 checks with an average time to complete this screener of 4 minutes and 41 seconds. The Benefits Screener helps Marylanders quickly and easily check their eligibility for Medicaid, SNAP, Emergency Assistance, WIC, Temporary Cash Assistance, and the Home Energy Assistance Program. In 2025, we will take the next step, launching a common application to increase benefit access. Building on the benefit screener, this common application will enable Marylanders to apply for multiple benefits with a single online form. The enhanced technology will simplify benefit applications, making it easier for Marylanders to access, apply for, and manage their benefits. Too often, we ask our customers to prove their poverty to us again and again. And our work with MDThink represents a critical step in meeting the needs of Marylanders in a way that is simple, seamless, and swift. Now, I'll turn it over to our Acting Chief Financial Officer, Jessica Smith, to briefly summarize our response to the first item from the analysis.
Good afternoon, Chair McCray and subcommittee members. In response to the first item, I will share the actions we have already taken and our plans to improve our closeout processes and financial reporting. We acknowledge our accounting errors and have taken immediate course corrective actions to improve our fiscal year 2025 closeout process, including making changes to the fiscal leadership team. Over the past 18 months, we have continued the systemic rebuilding of DHS finances, including rebuilding and or creating fiscal processes and invoice payment systems, realigning our top-line budgeting process to be program-specific, and themes entered so we have true quarterly performance measures. Developing more accountable systems to minimize federal fund drawdowns, and implementing quarterly expenditure monitoring with the local Department of Social Services and central programmatic units. What we have found is that many standard operating procedures simply do not exist within DHS. And while maintaining auditors' independence, we have worked in partnership with the Office of Legislative Audits and problem solved in real time to address or begin to develop the corrective actions for these issues. We have been proactive in communicating our budgeting challenges with the Department of Budget and Management beginning in 2023. And with DBM support and technical assistance, we have made major changes in our Office of Budget and Finance and will continue to do so at every level. Now I'll turn it back to our Principal Deputy Secretary, Carnicia White, to respond to the other items in the DLS analysis.
Thank you, Jessica. The second item was regarding the situation in which children are placed in hotels and our efforts to reduce placements in hotels. We concur with the addition of reporting on hotel stays for children experiencing out-of-home placement and will provide the requested information. Let me start by saying a hotel is never an acceptable setting for any child to stay in. If circumstances demand the state must intervene on behalf of a youth, we prioritize reunification and living with kin before youth is placed in any other setting. In addition, we have made use of our state rate reform and provide a quality assurance work in the fall of 2024 to help us hold each other accountable so that we maximize the chances that youth in Maryland are in the least restrictive and most clinical appropriate setting. We have adopted a practice of limiting the use of temporary hotel stays, and I want to offer a few more details on what we've done. In 2024, the Executive Director of our Social Services Administration began to facilitate case staffings between local departments and central office to understand the challenges and barriers for youth in hotels and the action steps needed to secure an appropriate placement. We've worked with local departments to ensure accurate data is captured, and with rate reform launched in October of 2024, the department issued clear expectations to our residential care providers to ensure timely response to placement referrals so that Maryland youth can remain in the state, and encouraging providers to develop innovative solutions so that we might get to yes for placement. We're finalizing a new policy that will require additional notifications and updates to the Office of the Secretary and our Social Services Administration. This will also include weekly staffing meetings to ensure that urgent actions are taken to move youth to an appropriate placement setting. As of January 27th, we had 3,689 youth in our state's foster care system. 28 youth were in hotels, 28 too many, but that represents less than 1% of youth in care. For comparison, a year ago, on February 16th, 2024, there were 54 youth in hotels. We're using every tool at our disposal to continue working towards ensuring no child experience a hotel stay. The third item was with regard to the timeliness of submission of reports and other requested information. Let me apologize on behalf of the department for the delayed reports. But we have made a concerted effort to ensure that the data reporting to you has our confidence and reflects our high standard of integrity. Over the past year, we have renewed our focus on ensuring any public-facing data is consistent, validated, and comprehensive. In our data review, we found that we had inherited antiquated and manual data creation or reporting processes that we just did not have confidence in. We have uncovered such challenges. As we uncovered these challenges, we immediately began to rebuild our approaches to reporting out our data. Addressing these unexpected data-related challenges while preparing reports or summaries Statistical analysis can take our team extra time, which can then lead to delays. We have prioritized improving data integrity and validating practices that we inherited. As a result, we developed a data office. This office is designed to modernize the agency's data collection and public reporting across various programs and divisions. We brought in new leadership across all of our administrations and hired key program staff that will allow us to consistently and accurately prepare reports for publication. With that, thank you for your time, and we will take any questions that you may have.
Seeing no questions, Madam Principal, Deputy Secretary, I'd just like to say thank you for first just taking ownership. I think that's what I saw when I read the testimony and a number of different things. I feel like I frequent the agency a good bit to understand some of the dynamics. So I just want to thank you all you and the team for your leadership. And Ms. Bugel, Ms. Zimmerman, Ms. Andrade, just thank you all for the comprehensive analysis that we just received. Colleagues, seeing as this is the last hearing and there are no public witnesses for this respective hearing, just want to say thank you again, and this ends it for today.